Good afternoon, this is Dr. Do again. This video is still on alphabetic list of problems on letter C. Today I'm going to talk about the cardiomyopathy and non-ischemic cardiac disease. Before I talk about that, just mention about any situation warranting emergency visit. If you have fever, you feel your heart beating funny, not regularly, and if you feel your pulse is kind of not, if you feel your pulse like one after another, there's if you feel paradoxical pulse, or if you could not feel your pulse, that's the emergency. You need to go to the emergency room, call your physician or call the emergency phone or go to the emergency room. So why I'm going to explain this, why these are the life-threatening situation, what are the causes for this just mentioned cluster of problem you need to go to emergency. Because before I talk about that, let's talk about the heart structure. We know, I mentioned the coronary arteries or blood vessels supply the heart. Heart has the structure like endocardium, myocardium, and the pericardium. So these three layers is the structure of the heart. Any of these structure undergoing inflammation or hypertrophy or viral infection or fluid accumulate, that will cause the heart to not function. The pericardium has two layers. One layer is around the heart, and the other layer is around the wall, the mediastinum, that structure. So in between these two layers of pericardium, there's a space. So if there's normally there's minimum amount of fluid, so the heart will pump and contraction, dilate, serving as a lubricating. So these two layers not stick together. But if there's fluid in between these two layers, that's emergency because your heart cannot dilate. So that's what I'm talking about. If you feel your pulse, you couldn't feel the pulse, or paradoxical pulse means when your heart is contracted, the pulse feel here is funny, is not consistent with the heart contraction. So this is the three structures. Any of these structures can have problem. For example, endocarditis. Endocarditis, it's not uncommon. In special group of people, like comorbidities, any other medical diseases, and can, for example, the older time rheumatic heart disease, that's very increase the risk for the endocarditis. So what the symptoms for endocarditis? Usually it's fever. It's very common because it's usually caused by the bacteria. Fever, arrhythmia, and that's the main symptoms. And may or may not have chest pain, but there's some other signs like the finger or the fingernails. But those are for the physicians to identify whether these are just the clues. But the eventually diagnosis for the endocarditis based on the echocardiogram to look inside of the heart, see whether there's some vegetations on that endocardium. So that's the diagnosis. In terms of treatment, of course, antibiotics is the first line to treat the infection. Usually the cause is the infection. So this is the most inner layer. Endocardium might have this endocarditis. Of course, if you have fever, you feel your heart pump, the heartbeat funny, either thrilling or shivering or irregularly make you feel dizziness, shortness of breath. These are the signs. Fever plus this cardiac signs, you need to see the emergency as soon as possible. Because if the arrhythmia continues to going, depends on where the inflammation is. If near the pacemaker, then it's kind of dangerous. Well, anyway, regardless, if you have fever, your heartbeat funny, this could occur in young people, older people, both groups. So, especially for those who have chronic diseases. So this is one of the sign you need to see the physician, the emergency room. And the cardio problem, I talk about the endocardium, and myocardium might undergoing a myocarditis, which means the inflammation of the muscles, the cardiac muscle, usually caused by the virus. Could occur in young people and older people, probably after the upper respiratory tract infection, and you develop this feel tired, very extremely fatigued. That's the major sign, because your heart cannot pump regularly, cannot infuse the blood, and that's the very important signs. Extremely tired and associated fever, may or may not have fever, and arrhythmia is also quite common, because the cardiac muscle is under inflammation. So if that's the case, even though you're not going to emergency, call your physician and visit your physician. The absolutely bed resting is the best to treat this viral caused myocarditis. There's another disease called cardiomyopathy. It's a whole group, either dilated or hypertrophic. What does that mean? It means the myocardium undergoing a long-term change, either lost the elasticity, or lost the flexibility, just over dilated, cannot contract well, or hypertrophic means the wall of the heart becoming thick. If you keep hypertrophic, if near the valve, that means obstructive condition. That's kind of serious. So this is usually these the cardiac muscle disease can be diagnosed by the endocardiogram also. So this is and pericardium, like I said, pericarditis is quite common, young or old, male or female, especially for systemic diseases like lupus or rheumatoid arthritis, or the infection. So these three causes can cause this pericarditis. Pericarditis is you feel the pain. The pain is related to the positional, or related to the heart contraction or dilate. And if the inflammation getting worse, like I said, the fluid accumulated, that's kind of, if you imagine there's the pericardium with the heart, and there's a fluid there, so the heart cannot dilate. That's kind of dangerous. So if that's the case, you need to, like I said, see your physician, visit visit ER, one way or another, get treated as soon as possible. So this is and the treatment, of course, the systemic disease like lupus or rheumatoid arthritis or any other connective tissue disease will be treated accordingly at the same time. Anti-inflammatory medication to treat the pericarditis. Your physician will decide and determine. Again, this is also the final diagnosis is the endocardiogram. Remember I mentioned about the test for the heart. Endocardiogram is very useful for all of these situations. So this is the cardiomyopathy non-ischemic cause. Again, all of these conditions can occur either young or old, or with or without systemic disease. The signs, like the warning sign, like you feel extremely fatigued, tired, fever or non-fever, and your heart beat funny, or you feel your pulse is not like usual pulse rate or pulse pattern. So that's probably, and you feel the chest pain with the positional, or with the heart contraction or dilate. So if these are, and also sometimes they're associated with the breathing, because the lung squeeze this heart and the pericardium structure. So also could be respiratory related. But so these are all the symptoms. Might either you go to emergency or call your physician and to get treated. So that's the video for today. Cardiomyopathy and non-ischemic heart disease and related pericarditis or endocarditis. So these are it's quite they are all quite common actually. So just through this video here. I hope it helps, and thank you for watching. See you next time.